Weeks before school starts, Texas children's doctors are warning parents that COVID cases are rising among children and hitting them hard. Some require ventilators. Dr. Stanley Spinner, Vice President of Texas Children's Pediatrics and Urgent Care, joins me live now. Welcome to Houston's Morning Show.
Good morning.
I have to tell you, as a medical reporter as well as a parent, this is scary. Originally, we weren't that concerned about COVID in kids. It didn't seem like they were getting those severe symptoms. Can you tell us what has changed?
Well, I think it's the Delta variant that's changed. We are seeing more cases now of kids being sick than really ever before. Our positivity rates are in the double digits at Texas Children's, and in our pediatric practices and urgent cares. The last week, we're actually around 20%. The patients being tested, about 20% of them are coming back positive. We're seeing more of our kids hospitalized. I think they are getting sicker. So we're not sure exactly why, but it seems to be connected with the Delta variant. That's the predominant strain right now.
And then when you take a look at how hard it's hitting these kids, it scares me even more. About 10% of these kids are in critical care, or at least 1 out of every 10 children who gets it have to go to the hospital. What's going on with these children? Do they have pre-existing conditions, or is this hospitalization happening in children who didn't have any prior problems?
Well, both. It's still the majority of our pediatric kids, our kids that get that sick do have underlying conditions. And unfortunately, there are a lot of our kids who do, whether they have heart conditions, lung conditions, diabetes, being overweight. There's a lot of these underlying conditions that we have in our community. But clearly, those are the hardest hit. But we are seeing healthy children with no known underlying conditions being hit hard with COVID now. So, yeah, we're not really sure exactly why that is.
Are there any specific symptoms of Delta that you would really like parents to watch out for and get their kids help before they need hospitalization? Is there anything that we can do at home to try to help get them through this safely?
Well, once someone's infected, there's not much you can do at home besides supportive therapy. Obviously, hydration is a very important, rest, trying to reduce fever for comfort. There are no medicines out there that are going to safely and effectively treat COVID, and certainly the pediatric population. But the symptoms are the same that they were, with the previous strains, fever, shortness of breath, coughing, runny nose, the symptoms that we see with the cold, the symptoms that we see with flu. So it's very hard to tell. Again, the majority of our kids still do well if they do get infected with COVID. I think the bottom line is if you see your child starting to, act sicker than you are comfortable with, then it's time to contact your pediatrician quickly.
All right, that is an important reminder for everyone to really think about to get those kids help. Now let's talk about what we can do as we head into school. It is just around the corner. We know vaccination is still not available for kids under 12. Others haven't been vaccinated. The governor isn't mandating masks in school. So what do you suggest that parents and children do to keep them safe as we head back into school?
Yeah, well, first of all, it's critical that our kids get back to school. We all agree with that. The Academy of Pediatrics agrees that we all are strongly supportive. So in order to keep our kids safe, we really need to get them masked and keep them masked. And we need to, we know that the schools cannot enforce it in the state of Texas, the public schools, but we really need to emphasize the importance for families and parents to really tell their children that this is how they can keep themselves safe and keep the rest of the family safe. Wearing masks really is critical right now. For those certainly that are not vaccinated, but even for those that are vaccinated, we're seeing evidence of what the Delta strain can do as far as spreading. So everyone should be wearing a mask. The faculty, the students, that is the most critical thing right now until we can really get more of our population vaccinated, which is going to take time, especially with kids under 12.
And Dr. Spinner, we've seen that kids have been struggling with mental health through all of this. I think with the masks, they don't communicate as much. But that being said, do you still feel like their overall health is more important right now to wear that mask than them trying to communicate better without it? Because I know they don't want to put it back on.
Yeah, no one wants to wear a mask, and I have a 4.5-year-old granddaughter, and it's terrible, but it's important. We are seeing a incredible surge in mental health cases, during this pandemic. Wearing a mask certainly isn't the best way of getting kids to communicate better, but the alternative is much worse. If our kids are getting sick and then they're missing school, in some cases being sick for long periods of time, not just for a few days, that's significantly more of a mental health burden to them and to their family. So, if you're looking at which is the best way to go, wearing the mask is absolutely the best protection and the best way of trying to prevent, the mental health crisis by keeping kids healthy and keeping them back in school.
Now that your beds are filling up at Texas Children's Hospital, it's certainly gotten my attention. I know a lot of parents, and so we appreciate you taking time from there today to tell us more about what's
happening.
Scary times.
Yes. Thank you.
Dr. Spinner.
All right. Thank you.